Good afternoon, everybody, and welcome to the first, and I hope not the last, I hope it's the first of many webinars that's been held by the UNSW Ageing Futures Institute. The topic of our webinar is the human rights of older people. And I'm just going to start with an acknowledgement to country. I would like to acknowledge the Piggott people, who are the traditional custodians of this land in which I'm joining you from you today. I also acknowledge the traditional custodians of the various lands on which all the speakers and attendees are meeting from. I pay my respects to the elders past, present and emerging, and extend that respect to other Aboriginal and Torres Strait Islander people who are joining us here today online. So just a little bit about the motivation for this seminar. We've been talking amongst ourselves in the Institute about various events. Of course, we're in the middle of a pandemic, but human rights issues just seem to be coming up over and over again with all of the Royal Commission. Then we had the bushfires and the way that the smoke was impacting people, especially vulnerable groups such as older adults. And then we've had a lot of human rights issues discussed in the media and just amongst friends and colleagues in relation to COVID. So we thought it was very timely to bring together some speakers from different disciplines and have more of a public conversation, at least amongst ourselves within UNSW, about this topic. So today we've got three speakers, and the structure of the webinar is such that we'll hear from our three speakers and then we're going to open up the floor for questions. Some people have already submitted questions when they registered, so we've got those. If you want to submit a question, please use the Q&A function, which you should be able to see on the right-hand side of your screen, and ask questions as we go. And if you see a question that somebody else has asked that you also would like to hear the answer to, you can like that question and that will sort of give it higher priority in the question list. So it gives me great pleasure to introduce our first speaker, Professor Andrew Byrnes. Andrew is going to be speaking to us on ageism and human rights before and after the COVID-19 pandemic. And Professor Byrnes is a human rights lawyer and advocate from the UNSW Faculty of Law and the Australian Human Rights Institute. And he has recently published his call for a comprehensive human rights-based approach to address the significant challenges for aged care in Australia. And Professor Byrnes is an associate investigator of the UNSW Ageing Futures Institute. So I'll hand it over to you, Andrew.
Great. Thank you very much, Kaarin, for the opportunity to participate in today's webinar. And I echo your acknowledgement of the traditional owners of the lands on which we're all variously located. And I'd like to congratulate the Institute on creating a space to discuss critical issues about older persons' enjoyment of their human rights in Australia in the time of the COVID-19 pandemic. Could we have my first slide, please? My argument today is that the pandemic has highlighted and further exposed widespread ageism and human rights failures in Australia. While the pandemic has brought new and tragic examples of the impact of ageism and inadequate human rights protection, the underlying phenomena are not new. The pandemic should stimulate all of us to increase our efforts to take on ageist attitudes, practices and institutions, and to use an explicit human rights approach in doing so. The pandemic and government responses have of course affected many different groups in societies, not just older persons, and I would not want to diminish the importance of identifying and responding to those impacts. Human rights should be part of our analysis and policy responses to those impacts as well. It could be said that human rights, or at least human rights goals and values, have indeed been part of the development of policy responses to the pandemic. But that has largely occurred in a partial, fragmented, often implicit and imperfect way. Some analysis, policy and public discussions of the pandemic have reflected ageist assumptions, and they've highlighted the ways in which we think about the place of older persons in Australian society. While the adverse consequences of ageist assumptions and policies may have been more extreme and stark in some other countries, they have nonetheless had an impact here and should continue to concern us. As Ashton Applewhite, the wonderful United States anti-ageist advocate, urges us, we must seize this moment and redouble our efforts. Have the next slide, please. The pandemic has highlighted the ease with which we slip into portraying older persons as a homogeneous and vulnerable group. Let's not forget that depending on one's definition of older persons, we can be talking about population cohorts that range from persons in their late 40s to persons in their late 90s and beyond. While the virus has affected many age groups, we know that its major impact has been on older persons. Initially in Australia and in other countries, the pandemic was seen as a disease. It was a disease of older persons, particularly in terms of their susceptibility to infection and to rates of mortality. So perhaps the early focus on older cohorts was understandable. But we quickly learnt that it was not just or even only age that was a critical factor. Age and comorbidities, age and sex, age and living in congregate care settings, and other intersectionalities were important. Furthermore, the impact of the virus has followed pre-existing patterns of economic and social deprivation, posing a threat to groups who include the poor, racial minorities, Indigenous peoples, and people with disabilities. Thus, the picture has become much more nuanced, at least in the technical discussions, though not necessarily in public consciousness. That brings us to ageism. I don't imagine that I need to explain to this audience the concept of ageism. You are all no doubt familiar with the stereotyping, discrimination and mistreatment on the basis of age that it involves, at the individual, but also the institutional and social levels. And a critical dimension, which we've seen, is also the extent to which we internalise stereotypes about older people and their or our value to society, namely limited and diminishing as we age. Let's look at some of the manifestations of ageism pre and during or post the pandemic. Though of course we're still in the middle of it in Australia in a way, and much of the rest of the world is still coming into it. Have the next slide, please. We're all familiar with the narratives that see the ageing of world populations as a potential economic and social disaster. The economic doomsday and great tsunami narratives, often dressed for scientific respectability in discussion of value-laden dependency ratios and estimates of the values of years likely to be lived under particular conditions. We're also all familiar with the stereotypes of older persons as a largely homogeneous group, infirm, non-contributors, unable to adapt to change, hopeless with IT, and a burden to their families and society. Negativity and devaluation have their converse in the valorisation of youth and the marketing of the need to look, feel and be young. We're also familiar pre-pandemic with the intergenerational equity debate, competition created and spurred by media and by lazy thinking about societies and the homogeneity of so-called generations, the interrelations between generations and the complicated social, economic, ethical and political dimensions of talking about intergenerational equity. OK Boomer is perhaps the most graphic popular embodiment of this. These have all been seen during the pandemic as well, and also in the discussion about how we best plan our transition out of the social and economic shutdown that it has led to. Seniors, the elderly, the aged, terms in common circulation, even the ABC continues to call older persons the elderly. But they've been the subject of recommendations about self-isolation not made to other groups, though in Australia, at least, those recommendations have not been embodied in legal regulation as they have in some other countries. Also prominent have been that the argument the present and future material and personal well-being of younger people is being sacrificed, once again, in the interests of the baby boomer generation. And we've also seen the troubling discussions or assumptions about the role age plays or should play in the rationing of access to critical care should health systems be overwhelmed. And one of the more extreme types of statements is one on that slide, that there's no point worrying so much about ensuring healthcare for older persons because they've already had a fair go, the fair innings approach, and are going to die fairly soon anyway. And we've of course seen stereotypes more generally. Next slide, please. I've listed on this slide 4 areas of particular concern where I think human rights have only partially entered into the equation, which would benefit from a much more rigorous human rights analysis. Each highlights both pre-existing challenges prior to the pandemic and ones which continue and with which we need to engage from a robust human rights perspective. The first, the right to long-term care of support, has been a very important area, not just because of the clusters of infection and the number of deaths that have occurred in some residential aged care homes. But that should cause us to reflect further and make more urgent some of the discussions that are already occurring within the framework of the Royal Commission into Aged Care, and ask whether the human rights of older persons are sufficiently central to those discussions. In particular, the question has become current, especially overseas, but also increasingly in Australia. Is it consistent with the human rights of older persons to have congregate living establishments of this kind, which in effect segregate older persons on the basis of age, expose them to greater risk in cases of pandemic, and possibly, or often, arguably do limit persons' right to autonomy, even in the best of situations and with the best medical and clinical support? The Royal Commission on Aged Care should be looking at options for reform that engage fully with the human rights framework, but it's not yet clear whether the Commission will go down that track. And it's perhaps worth mentioning, when I'm talking about the right to aged long-term care and support, there is no such right under international law. It's in none of the international treaties or in domestic human rights charters, and yet it's a critical element for both congregate and at-home support of the right to live independently and in the community of older persons. And it's one of the gaps that needs to be closed by the adoption of a new international treaty. Healthcare, of course, has been central to the pandemic. We've all seen the discussions about triage and the need to affirm that age should not of itself be a criterion for discerning access to critical care. This question, though extremely important, is at the end of a spectrum about older persons' access to healthcare generally, and also the access by persons who are living in aged care homes to the hospital services and other services that others might have, but which they may not have access to. Thirdly, elder abuse, the subject of significant concern now in Australia, something that arguably needs stronger legislative foundations, but we also need to ensure that we see it as a human rights issue, and also to collect data on how the pandemic may give rise to greater risks of elder abuse in all its forms, including financial abuse. In relation to the right to employment, we know that many hundreds of thousands or possibly millions of Australians have lost jobs, and that includes older workers. We know that one of the challenges in getting a job in the first place, and certainly in getting back into the workforce for older persons, are ageist barriers. They often end up being long-term employed if they get their job back at all, once they've lost it in their 40s or 50s. So then in conclusion, these are really just some hints of some of the major areas where human rights issues have arisen and which would benefit, I think, from a more explicit human rights-based approach, which requires governments to take explicit human rights informed policy decisions to justify restrictions on the enjoyment of human rights and their failure to support the exercise of human rights, and institute accountability mechanisms. So what we need now, most of all, is a coherent human rights-based framework to guide our laws, policies and programs as they affect older persons in our society more generally. We have international treaties for many other groups. We now need one for older persons. Thank you.
Kaarin, you're on mute.
Hi. Apologies, everybody, I was on mute. So I just wanted to thank Andrew for that excellent talk and putting forward so thoughtfully a perspective and a framework for thinking about these issues. And his talk leads in perfectly to our next speaker, Dr. Annie Herro. She'll be talking to us on a global perspective on the rights of older persons and a UN Human Rights Treaty. Dr. Herro is a visiting scholar in the School of Social Sciences and the Australian Human Rights Institute at UNSW, and her research focuses on the role of civil society in influencing ambitious and systemic political change at domestic and international levels. And she's particularly interested in the role a transnational advocacy network could play in advancing the campaign to establishing a convention on the rights of older persons. Over to you.
Thank you, Kaarin. Can you hear me okay? Is it clear? Yeah? Okay.
Yes.
Thanks. So thanks to the Institute for inviting me to this webinar. I'm really happy to be participating. Andrew started by making the point about the heterogeneity of older persons, and I planned to open with a similar point. So it almost goes without saying that the experiences of old age can be very different depending on where you live. So the rights of older persons won't be protected to the same degree in Afghanistan, for example, as they would be in Switzerland. And taking an intersectional approach on older persons, they experience the world differently depending on, of course, gender, race, class, sexual orientation, a whole range of other factors. But despite the diversity, next slide, please. Despite this diversity, human rights researchers have found that older persons, regardless of where they live and any socioeconomic differences, share common experiences of ageism and age discrimination. So as Andrew mentioned, in the context of Australia, we are seeing this globally in the case of the pandemic, but to more or less different degrees depending on what country we're looking at. The Director General of the World Health Organization has said that he believes that it's pervasive ageism and ableism, or discrimination in favour of able-bodied people, that explains the sluggish response to the pandemic from most of the governments around the world. And it was only after we realised that the virus affected others that we started to get our acts together. We're also seeing the meme that talks about the virus as a boomer remover, as if it's a good thing. We see aged care staff not getting access to enough PPE, and in some countries, leaders expecting and publicly expressing that older persons should self-isolate, even though it's more difficult for this group than others to be doing this, and telling everybody else to carry on with their lives and go to work, etc. And Brazil is probably the starkest example of this, but there are echoes of it in other countries. Human rights advocates have been critical of these kinds of lack of protections that I've just described, but they've also flagged the danger of slipping into or reinforcing the discourse of the fragile older victim, which we're also seeing perpetuated around the globe during the pandemic, and this can feed into ageism. So the human rights discourse emphasises both the empowerment and the protection of older people across all areas of life, not just in areas that are traditionally associated with older persons, like social welfare areas, income, housing, things like that. And it also is based on the premise that older persons have claims on society to have all their rights enjoyed. So across the spectrum, not just economic and social, but also cultural, civil and political, and that governments are legally obliged to protect and respect them. And one way that we can see this conversation about ageing and older persons and ageism challenged is through the global movement to establish a UN Convention on the Rights of Older Persons. And this took off about 10 years ago, and it's been pushed by some prominent domestic and international NGOs, interested governments, national human rights institutions, and interest groups and academics. One of the arguments for, could we get the next slide, please, Dan? One of the arguments for establishing a new convention would be that it would ensure that older persons become visible in the existing human rights system. So a common example of this, or the lack of visibility, is the right to non-discrimination, or the right not to be discriminated against in international human rights law. And this pretty much means that people who are the same should be treated the same, but people who are different should be treated differently. So older persons should be treated just like everyone else, regardless of age. But sometimes if an older person is particularly disadvantaged for some reason, maybe they're in a care facility, so they can't easily get out and vote, or maybe they lack cognitive capacity, so it's more difficult for them it's more difficult to identify their will on a certain matter. then it means treating these people differently or giving them extra support to make sure that they do get equal opportunities and that all their other rights are realised. So technically, older persons have their right to non-discrimination under existing international human rights treaties, but this doesn't really translate in practice because older persons aren't mentioned in most of the existing UN human rights treaties, and they're not really given much consideration in how treaties are interpreted. And this then trickles down to a national level where the right to discrimination against older persons is often violated. An example, and there are so many, that in some countries we see upper age limits for breast cancer screenings, for some surgeries, for medical rehab. So it goes all the way from the top to the bottom. The arguments for a convention include that it would change public perceptions on older persons from objects of charity or social welfare to holders of rights, and it could be a point of dialogue between citizens and their governments to shape domestic policies and laws around older persons. So it create benchmarks. Next slide, please, Dan. There's been some progress towards a convention over the last 10 years or so, but I'm just going to identify the setbacks because they're quite important, given that it has been 10 years at least that civil society has been calling for the establishment of this new treaty. And some of the arguments on the slide that we hear from governments are the bureaucratic arguments, like there are too many treaties, too many treaty monitoring bodies. We're already run off our feet trying to service the existing treaties. Why do we need a new one? Why don't we just make sure that existing treaties are relevant to older persons? Second argument, of course, is the economic one. We can't afford it. Older persons are expensive. Of course, they don't say this explicitly, but it's clear that that's what's driving a lot of the opposition, mainly because older persons are traditionally associated with economic and social rights, which are more costly. Another reason is that some states in Africa and Asia cite is that they say, well, our existing traditions and norms protect older people, and we have the families who are charged with looking after them, so they're not really the responsibility of the state. Civil society's tactics generally in advocating for a convention have been on the softer side, haven't been particularly confrontational, and I've argued that this in part stems from internalised ageism, and a product of this is that they haven't been particularly effective in getting governments to support a treaty, governments who haven't otherwise supported it. And a final reason is that the rights discourse itself doesn't resonate with some older persons and their associations, partly because it's perceived as being too legalistic or too adversarial, in that it is seen to pit older persons against younger generations, which is not something that that older persons are happy with. So there are various responses to each of those points, which we can go into if people are interested in question time. But finally, Dan, yeah, thank you. I was asked to think about some areas where further research can take place, and one of those areas I think would be really interesting to look further into is the intersection between ageism and ableism. So I think it's, in many cases, it's the fears around losing physical and cognitive capacity which contributes to ageism, and it can drive a wedge between anti-ageist advocates and disability rights advocates. And this relates to the second point, which is investigating intersections between disability rights and elder rights, especially where tensions arise. And a common case where a tension has arisen over the last few years is on institutionalisation. So many of you would be aware that disability rights advocates fought very hard for the CRPD to take a strong position against institutions, persons with disabilities living in institutions, and instead having them, supporting them living autonomously within the community. But some older rights advocates don't feel as strongly about aged care institutions, and their concern is more along the lines of combating loneliness, and it isn't really the institutions per se that they have a problem with, but rather ensuring that these institutions, within these institutions, that a standard of care is met, and that if they are there, that they want to be there, and if they don't want to be there, then there are other options. And finally, just very at a basic level, gathering data on particular groups of older persons, and I've mentioned women here because so much of the data across the globe doesn't exist. That's all for me.
Great, thank you, Annie. I'm now going to introduce our third speaker. Just hope that everyone can hear me. So yes, our third speaker is Professor John Piggott, and John is Director of the ARC Centre of Excellence in Population Ageing Research at UNSW, where he is also a Scientia Professor of Economics. Professor Piggott has published widely on issues in retirement and pension economics and finance, and in public finance more generally. His research has appeared in leading international economics and actuarial academic journals, and John Piggott is a commissioner on the US National Academy of Medicine's International Commission on Creating a Global Roadmap for Healthy Longevity, and is the lead investigator of the Economy and Policy Research theme at the UNSW Ageing Futures Institute. And John is going to talk to us on population ageing and the mature workforce. Thank you, John.
Hi, John, can I get you to unmute, please?
I always forget that. Thank you very much for the invitation and for the opportunity to speak today. My talk is going to take a somewhat different beat from the previous speakers. I'm going to try and make this a little bit quantitative, and I'm going to try and relate it to what is a global phenomenon and what gets me up in the morning and keeps me awake at night, and that's the demographic transition which the world is undertaking. So maybe we could have the first slide, Dan. So, and again, because some of these slides are segmented, thank you. The UN describes population aging as unprecedented, pervasive, enduring and profound, and all those words are actually very meaningful in this current context. You have, there's no parallel in human history. It's very much a global story. We're not going to return to young populations anytime soon, and it affects us all in very deep ways. Next slide. So to give some idea of the rate of change and the spread of change, when CPAR started back in 2010, there are only 3 countries in the world where 20% of the population was more than 65 years old. They were Japan, Italy and Germany. And by 2050, next slide. Next slide, please. Yeah, you can see that the map gets covered in red. And actually that's probably an underestimate of the aging phenomenon. The aging phenomenon is moving more rapidly than we anticipated 10 years ago. Next slide. And although there are 3 major contributions to demographic change: fertility, life expectancy and migration. In the current context, I want to focus on life expectancy. And I think there's a particularly interesting aspect of life expectancy, and it's the following. We've become used to the idea that life expectancy has been increasing for centuries. But actually, until about the middle of the last century, most of that increase in life expectancy happened at quite early ages. And you can see the pattern here in the way in which life expectancy has increased by age. Next slide. But by 1950, if you start looking forward from 1950, it was declines in mortality at later ages which drove increased life expectancy. And that took people, I think, a little by surprise. It took governments by surprise. It took families by surprise. And I think it certainly brought the issue of demographic change to the forefront of popular debate, although it took quite a while for that to be explicitly recognised. Even back earlier this century, population ageing was not something which people much talked about. It's really only since about 2010 people have been starting to talk about demographic change as something which is with us and something which is going to change the way the world looks over the next century. So I talk about not the Asian century, but the aging century. Next slide, please. So what I want to focus on particularly is the idea of mature work. Now, this is an area that's very difficult to analyze, I guess, properly. There is a lot of discrimination in the mature workforce, but there are a lot of other reasons too why older workers have trouble keeping employment or trouble becoming re-employed. But discrimination certainly plays a part, and discrimination is certainly very central to the topic of today. So some of working longer is unplanned. So this is a survey which took people at different ages and asked when they planned to retire. You can see some people wanted to retire at 55 and some at 60 and some at 65 and some at 70. Next slide, thank you. But actually they're asked that in 2005. By 2012, when they reached that target age, in most cases they were working longer than they actually expected, right? Or working longer than they had planned. And some of that was the economic impact of the 2008 recession, which meant people had to work longer in order to accumulate more resources for retirement. Some of it was perhaps just being hopeful that they would be out of the workforce, but they didn't want to work after I'm 60, that kind of thing, particularly for people who were at that point maybe in their late 40s. Next slide, please. Okay. So do people work longer? Well, if we take the last half century, yes. Women in particular, although this is very much what I think of as a cohort effect, the fact that women have been much more engaged in the workforce from younger ages in the 70s and 80s and have therefore kept their role in the workforce much more effectively as they age than older women. So that increase that you see in women, that's those lines in the background, there are other OECD countries, and of course the heavy line there is Australia. And if we look at men, next slide please, it's a similar sort of story, but not so marked. So men were working back in the 1960s and 1970s until quite late, and then there were a variety of institutional features like superannuation and so forth, which allowed men to retire earlier, and now they're coming back, but not nearly so strongly, I think. And when we look at the men in particular, I think with women the cohort effect probably dominates. With men, I think structural change has been very important. So now we're operating very much in the context of a knowledge economy, of an economy which is much less demanding physically than perhaps 30 or 40 years ago. And so gradually we're finding people are working more than we saw earlier on, right? But once again, Australia hasn't done as well as some other countries. So countries like New Zealand and Sweden, perhaps for different reasons, have done a lot better in trying to engage people, both men and women, in the labour force to later ages. Next slide, please. So the main drivers, well, I've mentioned demography already. There's life expectancy. People start working later. They have children later. and there's a reduced age difference between couples now, and all those I think contribute to people working somewhat longer. And I've mentioned the structural change, particularly in the first decade of this century. There was quite a strong labour market and wage growth, and I think that helps in maintaining people in the workforce at older ages. And then more recently, we've seen higher education levels and more mobility, and all that helps better health. All those things contribute to this somewhat increased involvement with the workforce that we do observe. And finally, policy has some impact, and with policy I have in mind things like increasing the pension age, and I've got down there discrimination law, but I'm not sure how effective discrimination law has been. It's been somewhat effective, but I'm not sure how genuinely effective, how quantitatively effective it has been. Next slide, please. So, working longer and older people, what actually happens? Well, in this slide, what we have tried to do, and I should have mentioned at the beginning, this presentation has been prepared jointly with Raphael Chomik, who's a senior research fellow in the centre. As we've taken, this is a few years old now, but I think quite germane to the current circumstance. We've tried to segment what happens to 55 to 64-year-olds, and we begin with males this time. And we have about 57% of them there in full-time work and about 27% inactive. Some are unemployed, some are in part-time work. Next button. It's the same slide, thank you, yes. There is some underemployment, and I'm making underemployment a quite narrow thing here. Most people of the group that are in, most people who are in part-time work don't want more hours. In that sense, there's only a small proportion actually underemployed. But then you take the unemployment group, you can see there straight away you can start to pick up aspects of discrimination, right? 18%, nearly a fifth, think that they were considered too old by the employer, right? And maybe some of that, too many applicants or no jobs, perhaps some of that is around discrimination as well. On the other hand, there are reasons why things like obsolescence, which could be addressed by other kinds of policies like retraining, they play a role as well. So you have to be quite careful as to how you interpret this. But there are various difficulties associated with finding employment. And someone mentioned earlier on how much more difficult it was to get a job if you became unemployed in your 50s, and that's certainly the case. Next button. Thank you. If we take that inactive population, about a quarter wanted a job, and that's what I think of as discouraged workers, right? The people who want a job but have kind of given up because the jobs sort of aren't there, and the longer they stay inactive, the more difficult it is for them to find work that will continue for them. Maybe they find work for a few weeks or a few months, but work that continues is more and more difficult to come by. And the final button on this slide. So of the people who are inactive, right, finally, right, there are various reasons for their inactivity, and health and disability is an important one. So improving people's health would already be something which allowed more active participation in productive work and in voluntary work, for that matter, through time. And so that's the final piece of this slide. Okay, and now I'm going to look at barriers, and some of these barriers relate, as I said, to discrimination. So health and caring, I think prevention, health prevention and good health care is extremely important. We've seen that in the current circumstance, of course, but we see it longer term as well. And then adaptation, things like flexibility and so forth in the workforce, I think that's very important. The Fair Work Act actually added some flexibility, but it's not particularly strong. It's there, you have to have a conversation now if someone wants flexible work, but it doesn't give a lot of power to the employee in that circumstance. And then you turn to issues of discrimination. Retention is a piece of that. I think it's sometimes difficult for the employer. So the employer might have to shed some labour, and he has an older person who has superannuation, who has the rights to some sort of income, and just has maybe one person or maybe a couple, maybe the other partner is still working. He can shed that labour, or he can shed someone who's aged 40 and has 2 young kids. And so there are those sorts of biases, and I hesitate to call that discrimination, but obviously it's not a decision that's being made purely in terms of the skill of the worker. Recruitment, I think, is much stronger. I think with recruitment, there's a lot of discrimination. That's my subjective impression, and it's borne out by various surveys. There was an Australian Human Rights Commission survey in 2015, which found quite a lot of people, a quarter of people in the labour force aged 55 and above were reporting instances of discrimination. And I think that comes through quite strongly with the practices of employment agencies, as well perhaps as direct attitudes on the part of major employers. So I think that's a definite source of discrimination in the workplace. And then the skills and training, and here I think we are not particularly up to date, and we could do a lot more. I think the idea of retraining is really quite important. There's not that much research on the efficacy of different kinds of retraining programs. It's quite interesting. Lifelong learning is something which hasn't received a lot of attention and should receive much more. And it should also, it seems to me, receive much more attention from policymakers in terms of active programs, because this would be a way of keeping a very vibrant workforce, a very productive workforce. This is an enormous group of people, and as I kind of implied at the beginning, but perhaps didn't make completely explicit, this is a very large resource that economies really have to make use of, quite apart from any ethical considerations. This is a huge resource, and we can't allow attitudes or other kinds of institutional barriers to prevent those people taking full advantage of the labour force to the extent that they wish. Finally, there are things like pensions and taxes and so forth, institutional barriers and incentives, and they have not moved as fast as they might in the light of demographic transition. In this respect, we've done probably as well as most countries, better than many, but that's an area where we've not fallen behind, but nevertheless there's a lot more to do. I might stop there. Thank you very much for your attention. Last slide, I guess. Oh, and I should mention before. Oh, there is a last slide. So this relates back into COVID, and here, this slide comes from a fact sheet. We have a couple of relevant fact sheets in CPAR, which you can get to by going to our publications page. But we did one actually on COVID and employment and health risk and so forth. And this looks at the way in which people have become unemployed as a result of COVID. And you can see the younger group are more likely to become unemployed. They're the groups aged 20 to 29 and maybe 30 to 39. Yes, those groups there. And then as you move onward to the right, this gives you not currently, but historically, the probability that you become retired or discouraged, that you don't work again. So the group aged 50 to 59, there's a 15% probability, this suggests, that you won't work again. And that's a very high number of people. People talk about lives versus livelihoods, but it's actually lives versus life trajectories. Right? It's people in their 50s, they're planning to pay off their mortgage, they're planning to have a substantial superannuation accumulation when they eventually left the workforce at 66, and instead there's a substantial probability that they'll never work again and will have to draw down on their existing superannuation to pay on their mortgage and live a much less affluent retirement than they would otherwise. And I think that's a group that's a group that really worries me in the current circumstance. It's true that the younger generations, people in their 20s, are more likely to lose their jobs, and it's also true that JobKeeper has relatively protected older ages because they're the people who satisfy the 12-month rule. So younger workers are frequently casuals who only have a few months in, and then they're not protected by JobKeeper. But nevertheless, there's a large number of people who are likely, right, not to work again as a result of becoming unemployed, consequent upon the shutdown of the economy with COVID. So I will leave it there. I'm sorry, I'd forgotten that I'd added that last slide at the last minute. Thank you very much.
Thank you, John. Thank you, John. We're going to move straight on to the Q&A. Because we've only got 15 minutes left, and we have had a few questions pop up and some that have been emailed in. I might start, so I think I'm going to read out the question and then speakers can wave if they'd like to answer them. But since the first question I can see on my screen is actually for John, I might just kick off with that one. That's a question that says, ask John, what's your view about the early access to superannuation policy to address COVID-19 related income distress, especially in terms of women's financial security in retirement?
I think it's a very good question, and I really don't have a convincing answer. One thing I think is that it's probably not the most desirable response, but I think it would be a very difficult thing for any government to resist in the current circumstances and given our current superannuation arrangements. What I really hope is that it does not become a precedent. I think one of the strengths of the superannuation system that we have, which is a pre-funded plan and therefore one of a relatively small group of successful plans of this kind around the world. One reason it's been so successful here is that governments of both sides have really held the line on hardship. So it's possible to access superannuation on hardship grounds, but that has been not something that has been granted lightly. I think actually the politics here is to be commended because it's very tempting to give in to that. Now we have a bit of a precedent of giving in, and I think that this is an area where we have to say, well, look, that was a very special and unprecedented circumstance, and it's not a precedent for the future, right? We're going to hold the line again. I think what I've seen from data is that a lot of the expenditure is not essential expenditure. A lot of the expenditure is around discretionary expenditure of various kinds, and the long-term consequences could be significant for people who take full advantage of that, take the full 20,000.
Right. Thank you. The next question is one that was sent in at registration, and that is, and this is for any of the panelists who wish to answer it. Could you discuss the human rights of older adults kept in nursing homes against their will?
Yep, that's Andrew here. May I?
Yeah.
Yep. Before I do so, can I actually respond to the earlier question, because I think,
yes.
I think the question and the response from John, I think, raise interesting issues which have come out of the different perspectives from which we've come to our presentations, and I think I guess my argument has been, and that of others has been, that a human rights framework is a useful normative and policy framework for approaching these issues. And I think there were elements of that in what John was saying, talking about barriers and discrimination and so on. Of course, there are other normative frameworks, economic efficiency, and so on. But if one were to apply that to the superannuation issue, one will come at it as a human rights person with the obligation of the state to ensure that everyone has an adequate standard of living, including social security. And that would then involve some assessment of the resources that are available to the government within the context of the current borrowing that they've been able to do, and whether there are ways in which that is reasonably available to support those people who might otherwise want to raid their super savings. And that in seeing that as a potential obligation on government to at least consider, and given the so-called underspending, would be a possibility, and then looking at that in relation of the obligation of a government to ensure the economic security of people, in particular women who are affected here in older age, through allowing them to build super foundations, might lead to an outcome which would potentially follow in human rights terms. So that, I think, is an illustration of how a human rights framework might produce a particular mode of reasoning and outcome, and one could apply it across work and other areas as well, and why I think it's an important alternative perspective on how we approach some of these problems. But I've spoken too long. I won't pick up the other question because I've taken up time on that one, unless you want me to.
I'm happy for you to start with responding to the other one as well, and I don't know if Annie also would like to comment on that.
Look, it's a tough question. I'm not quite sure. There are different circumstances which would fall within this notion of human rights of older adults kept in nursing homes against their will. But basically, I guess if the starting point is that a person is entitled to freedom of movement, freedom of personal autonomy, protection from arbitrary detention, then of course a person should not be kept in a nursing home, an aged care place, against their will. Now, the circumstances, I think it's hard to talk. If someone has lack of capacity, one then also needs to think about ways of supported decision making and the nature of the decision they can make. But the initial starting point should be people should be not arbitrarily detained. The question, what is arbitrary and what conditions and so on, I think it's a very complex question. I think the human rights issues about aged care homes go well beyond that in terms of other issues, though, of course.
Yeah. Okay. Any more any more responses on that one, or should?
We only agree with Andrew. I think residents of nursing homes can only realise their rights within an agreed process for supported decision making, and it is a complicated one, but it always goes back to the will and preferences of the older person, and trying to ascertain that and respect that will as far as possible. Of course, the question of if an older person chooses to live in a nursing facility, there needs to be laws and regulations to ensure that their rights are upheld within that. But as for whether or not they're there or not, I mean, the pretty boring, a simple answer to a complicated issue is that you have to go back to what the older person actually wants.
All right, thank you. I think we've got time for one more question. And I'm going to ask this one that was sent in by one of the audience, which is, do the panellists have any ideas for how to develop effective policies for older persons that account for intersectionalities, e.g. intersecting gender, disability, culture, economic status, power, while still remaining relevant to broader populations? So it's a very high level question about bringing a number of areas of discrimination and disadvantage and advantage together. So I guess we're also thinking of this in terms of the Institute's work. As interdisciplinary researchers, a number of us are focusing on one area or another, and how can we also work together with different frameworks?
If I may, I think there are 4 points. One is awareness of those intersectionalities. Secondly, I think it's the collection of disaggregated data. Even in the COVID thing, there's just looking at the Department of Health site, there's not a lot of disaggregation of data beyond the classic categories. listening to those who belong to those groups, and ensuring participation in policy and decision making by representatives of those groups. I think it's will be four components.
Excellent. Does anyone want to add to that one? No? Okay. We've got a couple of minutes. I might ask just one more. Do you have any, how do you think that different disciplines can work together? I guess it builds on what Andrew just said about, but how could we work together to accelerate change in human rights for older people or to address ageism across disciplines? I'm thinking of this as institute collaborations and initiatives that we could undertake.
Well, I mean, I come from economics, you see, and I always feel that I'm being kind of caricatured as an economist, but it does seem to me that discrimination has very many costs, and demonstrating those costs is one way to engage policymakers in being effective in bringing in regulations, bringing in laws which might diminish regulation.
So, I mean, that's really helpful, because the thing about the disaggregating the data is something that we could all do, and that would inform the costs. So
yes,
I think even just hearing what we've heard here and pulling that together would enable us to approach things better. You're on mute.
I'd just like to support that, because one of the challenges that the international discussions are running into is the need to add to whatever framework, in particular human rights framework, the knowledge and perspectives of economists, social scientists of different sorts. So it is a powerful argument for governments to show that introducing human rights is not going to have unjustifiable economic costs. It's not all about costs, of course, but where data can be brought that shows that we are losing in economic terms as well as in human terms, it can be very powerful. So getting, I think, that discussion going and bringing that expertise into the different rooms, I think is a very valuable thing to pursue.
Excellent, thank you. So we have to wrap up now. So I just want to really thank our speakers. We've got to give you like a virtual clap because we're not here in the live audience, but it's been a fabulous combination of talks, very thought-provoking. And I just wanted to invite anyone who's watching today who's not a member of the Institute who'd like to affiliate to get in touch with us. And we have an application process to become an associate investigator. And encourage you to keep up to date with our work by visiting our website and following us on Twitter. And I hope everybody also tunes in for our next webinar and stay safe. So hope at some point we'll have another face-to-face meeting this year on campus as well. So thank you, everyone.
Thank you.
Bye. Thank you.